Imagine a 16-year-old who feels scared, helpless, and uninformed after they find out that they could potentially be pregnant. And it's not because they were careless, but merely because no one ever taught them on how to better protect themselves. Thousands of teens every year face unplanned pregnancies and the risk of STDs. And this stems from the lack of inaccurate education and unreliable resources. This can affect their health, their education, and even future opportunities. Hello, PTA committee. My name is Arissa, and as someone who has grown up seeing how misinformation and shame surround sexual health, I believe that access to knowledge and protection is a right and not a privilege. Schools and healthcare clinics should provide teens with birth control options and comprehensive sex education. This can prevent those unplanned pregnancies, STDs, and also empower teens to make educated decisions on their body. And the fact of the matter is, comprehensive sex education works. In a 2016 peer-reviewed journal posted by Emily Relly, she states that the data shows the more sex education that's provided to adolescents, the more likely they are to use contraceptives. And those who are using less effective forms of birth control switch to a more effective form once they are educated about birth control. I've always been an advocate for individuals to have the correct information before making decisions on their own bodies. And as a future healthcare leader, I want to lead with value and give this power to young teens across the country. Comprehensive sex education programs in schools give support to parents who just don't feel comfortable talking to their kids about this at home. And unfortunately, 47 out of the 50 states in the US allow minors to receive forms of birth control without their parents' consent. So it is up to us that we make sure that if they're going to go ahead and make these decisions on their own, they are at least informed about them. Access to birth control helps teens' health and futures. In Dr. Lisa Romero's peer-reviewed journal, she states that the US teen pregnancy is up to 7 times higher than some developed countries. Preventing unplanned pregnancies allows teens to focus on education and career goals, and in many cases can also help manage medical conditions like endometritis and irregular cycles. Health and education leaders have the responsibility to protect public health and not to avoid these uncomfortable conversations. Beyond physical health, sex education also promotes emotional and social responsibility. Honest sex education encourages responsibility and not promiscuity. In a sex education journal by Sue Dyson, it is stated that the school-based education remains the most effective way of reaching the greatest number of young people before they are sexually active. Open conversations remove shame and confusion, helping teens make better decisions. And when leaders treat sexual health as a normal part of human development, students feel safer and seek help by asking questions. Teens deserve truth and respect, not fear, misinformation, or even judgment. I believe that schools and clinics should provide teens with birth control access and a comprehensive sex education to promote safety, responsibility, and equality in healthcare. Comprehensive education prevents risk, birth control access protects health and futures, and healthy conversations build trust and responsibility. If we truly care about protecting young people, we must give them the tools to protect themselves. Empowering teens with education and access isn't promoting recklessness. It's promoting leadership, knowledge, and health. Knowledge is power, especially when it comes to protecting your future. Thank you.